Good morning, everyone. Welcome to the third session that we are having this morning. The third session will be handled by Dr. Bipin Ravindran on mental health and well-being, an overview of mood disorders in young people. We hope you enjoyed yesterday's sessions. We hope you'll be able to put it into practice and help both yourselves and your students when it comes to understanding issues. So without much ado, I'll ask Dr. Bhuvaneshwari to introduce Dr. Bipin Ravindran to us. Thank you.
Thank you, ma'am. A warm good morning to everyone. It's my privilege to introduce Dr. Bipin Ravindran. Dr. Bipin graduated from JIPMA, worked in government service in Puducherry and private hospitals in Abu Dhabi as general practitioner. Sir moved to UK in 2002 to pursue specialist training in psychiatry. Sir is currently working as a consultant psychiatrist in Nottingham for the National Health Service. Sir has specialized in organic brain disorders, including dementia and mental health in older people. Sir has special interest in teaching medical students, psychiatry trainees, and other professionals. Sir has involved in research in efficacy of two different modes of administration of transmagnetic stimulation for the treatment of persistent depression. Sir's hobbies include traveling, listening to music, playing guitar, watching movies, playing badminton, and reading. Sir is also a self-proclaimed foodie and enjoys occasional cooking. Thank you, sir, for being with us. Kindly take over the session, sir.
Thank you, ma'am. Good morning to you all.
Sir,
I don't know whether you can see my screen.
We are able to see, sir.
Okay. So again, good morning, good afternoon, good evening, wherever you all listening from. I'm going to talk about mood disorders. Let me bring the slideshow on. So, ma'am just explained, I am Dr. Bipin Ravindran, working as a consultant psychiatrist. I work for the National Health Service, which is basically government service in Nottingham in the United Kingdom. So I'm going to talk about mood disorders. My main focus will be on depression because I'm quite passionate about this illness, how it affects individuals, families, etc. So there are various types of mood disorders. So mood disorders basically means your mood is either very low or high. So it can happen. It's severe depression. You get very low mood. Bipolar affective disorder is also known as olden days, we call it manic depressive psychosis or bipolar mood disorder. You can get two poles, which is one pole is depression, the other end of the spectrum is going high, manic. So it can fluctuate. You can get depression, followed by mania, or start off with depression, then mania. So that becomes bipolar affective disorder, and you get depression in it. Then you have low-grade depression. It's lasting for, let's say, 2 years. We call it dysthymia. And then some people have ups and downs, but not to the extremes like depression or mania. We call it cyclothymia, which again lasts for at least 2 years. So why is mental health relevant? Why are we talking about this so much? If you look at globally, more than 264 million people are affected with mental illnesses. It affects your day-to-day functioning. It affects your performance at school. It affects your relationship, work, and functioning, day-to-day functioning. It affects every faculty of your life. Suicide is one unfortunate complication of depression. Um, Fortunately, the suicides doesn't happen with every case of depression. So it is not that rare. It's close to about 800,000 suicides globally yearly. 800,000 is 8 lakhs. It is the second leading cause of death in younger people, 15 to 29, which is shocking. This is an avoidable um, avoidable waste of life. It's an avoidable cause. It is preventable. If you look at this graph, I adopted this from the World Health Organization, WHO, and if you look at the total causes of death, both the sexes, the male and female, road injury being the first one, and the second one is suicide. In females, again, it's a suicide. In males, it is the third highest suicide. But if you look at combined figures, it's the second leading cause. Why is depression so important and mood disorders? So mood disorders, most of the mental disorders begin when in your early stage of life, when you're like between 12 and 24, but it sometimes manifests later. So it may not always manifest in the early days. As mentioned earlier, it affects your social functioning, psychological well-being, educational achievement, your academic achievements. It can lead to substance misuse, smoking, drinking, drug use, can lead to, it can affect your employment, lead to absenteeism, losing your job, affect your relationship with your family, with your children, parents, friends, even at employment relationship with other staff, etc. And the risk of suicide. So look at nationally, if you look at in India, 1 in 20 people suffer with depression. So it's a very high figure, 1 in 20. And 1.9% suffer with severe mental disorders, so severe that they cannot function normally. So if you look at the trend of depression, who is more affected? Unfortunately, it's more in women because of various reasons. People with poor economic background are more prone for depression. Divorced, widowed people are more prone for depression. More seen in nuclear families because of your lifestyle, having only two parents or one parent, single parent family. You don't have that security of a joint family where you have multiple adults whom you can form like a parental figure. So you have many parental figures in a joint family, whereas nuclear family solely depend on your two parents or a one or a sole parent, and that causes more issues. Urban areas, you're busy in your life, people move from suburbs or villages to urban areas to look for work, job. You don't, unfamiliar place, crowded, your living environment is not very good, commuting daily, not having contact with your family back home as much as you would like to. Nobody cares for you, everybody is busy in their own ways. So all that affects your mental state. Any significant life event in the previous 6 to 12 months is quite noticeable in onset of triggering depression. Significant life events can be can be losing somebody you love, can be a partner, spouse, boyfriend, girlfriend, parent, children, or losing a job, financial loss. It can be a sudden change in your life, something catastrophic, any diagnosis of illness which is chronic, anything catastrophic happening to your life in the last 6 to 12 months. In children, usually it's stress at school. It can include academic pressure, peer pressure, bullying, etc. Parental loss below age of 18 years is a significant it plays a significant part in causing triggering depression in children and adolescents. Parental disharmony, there's fighting, there's arguments at home, the atmosphere at home is not very conducive. The anger is sometimes is displaced onto children. Children try to avoid by moving away from the scene, not coming home, most of the time spending outside the house to avoid the atmosphere at home. Eldest birth order are more prone. Not everybody who's born first is going to be affected with depression, so don't worry. But they are slightly more prone for depression, eldest birth order, because they when they're born, the parents treat them like a project. I mean, they want to go children to go for tennis. They want to learn this. They want the child to go for tuition, etc., etc. So the child receives so much of attention, and the child wants to be perfect for the parents. He wants to live up to the expectation. Even the younger, when the other children are born, siblings are born, he wants to look after them, and he kind of takes on like a semi-parental role and doesn't want to fail, and that causes so much of stress and pressure on the eldest birth order person. Social media, I'm sure people will be asking about questions about social media, how it affects mental state of people. So any interaction with social media, like an upward social comparison, for example, you look at Facebook or Instagram, you see beautiful people posing in front of luxury cars or sailing in yachts, having a fantastic lifestyle, traveling all over the world. So everybody's perfect on Facebook, everybody's perfect on Instagram. So even though that's not the real picture, we all know that. But there is subconsciously, you tend to compare your life. Oh, my life is rubbish compared to their life. Look at them, what they're doing. So you compare yourself upward situation. You're not going to compare with somebody who's suffering or anything. So you're comparing yourself with the upward social comparison. And that over 4-year period, they found for every hour excess of screen time, the chances of depressive symptoms are higher, screen time. So next question obviously is about gaming. So gaming is basically, interactive online games. It never used to be interactive in the beginning when it came out. You shut yourself in a room and play, but now it's more interactive. So playing video games is not a predictor of depression or anxiety. This is a study which came out in Canada, because they feel what they found is gaming has become more like a social activity. So you're not playing on your own. You have your friends joining in online. You may have people all over the world joining in, but it's got its own drawbacks, because you have to be careful about internet safety, who you're talking to. Don't give your address, name. Don't agree to meet with these people outside of your house. Don't give any details. Only talk about your game and nothing else. And sometimes people can be rude. There's always even bullying going on in online gaming. So people can gang up each other and keep defeating you in the game. So all that kind of below the surface bullying goes on in games. So you have to be careful. So you have to use your common sense or instruct your children about that. Make sure that the games they are playing is suitable for their age. That's very important. So they have gradings like parental guidance, PG or G. G is for general. They are suitable for children. Otherwise, they'll say 13 plus, 15 plus, 18 plus. So make sure that they are playing the appropriate game. Watch when they're playing the game. Be there. Maybe if you're interested, you can take part in it, and let them observe you how you handle how you handle the situation which arouses when you're playing the game. Take breaks. Tell the children to take breaks when they're playing. Restrict the timing of the playing so they can maybe just before they have dinner or just after they have dinner, before going to sleep, because it can stimulate your brain. They may not sleep very well. It can affect your sleep. So you need to make sure this safety online gaming. There's been another study which says too much of online gaming can cause addiction, and maybe in the future it can cause behaviors like gambling, etc. But there is no strong evidence yet. But the DSM-4 classification, that's a book where they classified illnesses. So you got DSM-4, you got something called ICD-10. So DSM-5 is considering to add on as addiction disorder. Fast-paced, there was another study like fast-paced video action games actually caused improvement in rumination and subjective cognitive ability in depressed individuals. So in depression, what happens? People cannot focus on things. They find it difficult to um, listen to conversation because their mind is occupied. They're thinking about all the sadness, all the sad things in their life. So they're ruminating. Sometimes it can even affect your cognitive ability. Your thinking slows down. Your intelligence, not intelligence, your judgment, reasoning, everything slows down. So they say they did a study and they found fast-paced action games sometimes help with rumination. Okay, so coming back to depression, what are the main symptoms? As a teacher or educator, as a parent, you will want to know that. Low mood, everybody knows that depressed mood. You lose interest. So somebody who's been playing music every time, listening to music, starts withdrawing, not listening, not deriving enjoyment from listening to music. Or somebody who plays games, stop playing games, not going out. You feel tired all the time, excessively tired. Even if you do a small job, you feel very tired. And it's like running a 12-volt machine on a 9-volt battery. That's a comparison. You may have all somatic symptoms. When I mean somatic symptoms, it's like physical manifestation of mental illness, like you can get aches and pains, backache, headache, dizziness, palpitation. Sometimes people only present with somatic symptoms, which can cause misdiagnosis of depression, mental illness. They go from doctor to doctor to try to treat the backache or headache. Maybe the underlying cause is depression. Irritability and agitation, more so in youngsters as well as older people, they can become more irritable. Other symptoms, as I mentioned, concentration is affected. Your self-esteem is very low. You lose your interest in physical, intimate relationship with your spouse. You feel guilty. Things start thinking, "Oh, my life is not worth it." Sometimes delusional thinking sets in. When I talk about delusion, it's a belief which is unshakable. You cannot tell the person, oh, it's not real. So if, for example, someone who is very rich keeps thinking, oh, I don't have any money, I'm in abject poverty, and whatever you choose, even if you show them the bank statement, you got so much, you got all this land, you got all these houses, they're not going to believe it. They become so it's almost like it is a psychotic belief. Pessimistic thought, the glass is always half empty rather than half full. They don't see anything good in anything. It affects your sleep, or in two ways you can sleep. Usually it is lack of sleep, is poor quality sleep, interrupted sleep. You wake up too early, is normally less than 2 hours than your normal waking time. So if you normally wake up at 7, you'll be waking up at 5, and then you can't go back to sleep. You'll be thinking about all the depressing thoughts. On the other hand, some people have hypersomnia, that is, they sleep excessively. They wake up, have breakfast, go back to bed, have lunch, go back to sleep. Excuse me. Appetite, again, it can go both ways. Mostly we see reduced appetite. Some people do comfort eating. When they're upset or distressed or feeling low, they go open the cupboard, fridge, and keep munching all the time. So if there's a change in your body weight of more than 5% in a month, that is significant. Then thoughts of self-harm comes in. I think sometimes they start thinking, oh, I'm a burden. I'm better off not being here. I'm a burden to my family or spouse or something. So they make plans. It may be a passive wish, oh, I wish I went to bed and never woke up. Or it may be an active wish, like they want to, they're planning, hiding a rope or buying medications or whatever, planning an attempt, or they make an attempt. Psychotic symptoms, like I said earlier, delusional thinking, sometimes hallucinations. They think delusional thinking, like they think your intestine is not working, I can't eat, or I am dead, I don't need any more food, or my body is smelling. And then you can get hallucinations, like your senses can you can start hearing voices sometimes saying that you're rubbish, you're useless, or you can smell things which are not really there. We call it olfactory hallucinations, like your body is smelling very bad, rotten smell from the body. So if you look at a depressed person, so I found this picture on the internet. So you can see he's not, well, actually, this is a fashion nowadays. Anyway, you can see he's not well groomed. You can see the corners of the mouth, it usually goes down. So if you look at the on your mobile phones emojis, the emoji for sadness is an inverted U, like mouth. So it's something like that. And you can see here, I don't know whether you can see properly. I'll use the laser pointer. This is this frown. This frown is this part of the brow lifts up, and it's not like an angry frown. So it's a different kind of frowning. Take off it. Okay. Your movements are slow when you're talking. There is no hand movements, nothing. It's everything is slow. You're agitated. On the other hand, some people are more agitated, especially younger people or older people. You get agitated depression. They're pacing, plucking the fingers, wringing their hands, rubbing their hands, rubbing their legs against each other. When they sit down 2 minutes, they want to walk. When they walk, they want to sit down. So they're very restless. Your mood, obviously, you feel miserable, usually throughout the day, nearly every day. And sometimes there's a diurnal variation, which basically means you may, one part of the day, say in the morning, you feel the worst when you wake up and you think, oh, I've got this whole day to go through. And then gradually, as the day progresses, maybe by evening, 6, 7, you slowly start feeling better. Or it can be the other way as well. You become more irritable, your speech is slow, there are long pauses. So if you ask them a question, they take ages to respond. It's not that they're not hearing, everything is running very slow. So your thinking process is also slow. This is just, I'm talking about the thoughts, they feel worthless. I'm showing the picture of the glass, where the glass is half empty rather than half full. Any success, they'll discount it. They will say, if you tell them, oh, you got excellent marks in these subjects, but so focus on that. But the person will be focusing on, oh, I didn't get 90% on maths or whatever. Pessimistic, they don't see anything going to get better. Everything is doom and gloom. There is no light at the end of the tunnel. They feel hopeless. They feel guilty. Let's talk about a scenario. It's a real life scenario. It's a 18-year medical student, school topper. He was excellent in school. He won many awards, prizes. He had a very stable family, happy childhood. So family, you can't blame the families. He had everything. He came to medical school, and suddenly he realized it was one of the difficult medical schools to get in. He realized everybody is brilliant at the medical school. You are just one among them. And then that really made him feel little in that whole group of people. So he started struggling to cope. he felt he's not able to understand what is being taught. There's a sudden change of subjects. So in your school, you're not really geared up to medical school. Now, I understand you got coaching and all that now, but still he found it very difficult to cope with it. So he started missing classes, which made it like a vicious cycle. So when you miss class 2, 3 times, then you go back, you forgot, you don't know what was taught. You can't catch up. You are trying, always trying to catch up. It's a catch up game. And then he gave up. He started smoking weed. Weed is cannabis. Mixed with the wrong crowd. He started self neglecting. He was low in mood. And then he grades suffered, obviously. He wanted to leave the course. Suddenly he went missing. After a few days, search parties went around. They found him, like a forest kind of area. He was trying to do some kind of meditation. Luckily, people were thinking the worst, but he was only trying to do some meditation. His parents were informed immediately. They came, took him away, and fortunately they took him to a psychiatrist who treated him appropriately with the help of some psychology as well. And after 6 months, the medical school was willing to take him back, and he joined as an additional student, and completed the course successfully, and he's a doctor. Suicides, these are taken from the newspapers. High suicide rate in India, crisis. Student suicides are rising. 28 lives lost every day. That's a huge, huge public health issue. It's a huge loss to everybody. There have been some high-profile suicides recently in India as well. So statistics in suicide, about 230,000 suicide deaths. That's 2.3 lakhs in India annually. And the number of suicide victims are going up. Youngsters and women are going up. So if you look at globally, 3 women dying from suicide in the world, one of them is from India. It's a huge, huge number from India due to suicide. It is a major public health crisis. And this is something the government need to recognize and work towards reducing it. There are ways you can reduce this. I'll come to it. Causes of suicide, there is no single cause for suicide. It is multifactorial. So there are many factors. It can be a psychiatric or a medical cause, personality disorders, mood disorders like depression. You can be addicted to alcohol, drugs, schizophrenia, depression and schizophrenia. Previous attempts, deliberate self-harm, DSH is deliberate self-harm, which is taking overdoses or attempting to harm yourself, cutting yourself, doing things to harm, basically. Certain medical conditions like epilepsy, chronic medical illnesses like cancer, all that can trigger suicidal thoughts. Interestingly, the number of suicide they found is low when there's a war going on or there is a revolution, because even though you are thinking about all the depressing thoughts, you are in company of others fighting a common cause. Excuse me. So you feel part of the gang or crowd. But suicide is high in economic prosperity as well as poverty, joblessness, unemployment, divorce, etc. Biologically, people with impulsive behavior are more likely to commit suicide. Aggressive behavior, even in depression, some people are very angry, depressed, angry, agitated. They are more prone for committing suicide, and there is a small genetic component as well. Hopelessness is the thinking that nothing's going to work for me, that I can't see any way forward. The only way I can think of is end it all. This hopelessness and the trapped feeling is one of the significant thought processes which can lead to suicide. Not always, but can. Certain occupational groups, veterinarians, doctors, unfortunately, pharmacists. We all have access to medications. Doctors, anesthetists who got access to all the anesthetic drugs, and morphine and pethidine and all that. So you can get addiction as well as suicides in these groups. Farmers, they have access to um, chemicals, pesticides, etc. Here in UK, the farmers are quite well off, and they have shotguns and access to weapons to ward off foxes and vermins. So you have the access. Media coverage is very important. If there is a suicide, it's all over the media. It's all over newspapers, WhatsApp, Facebook, everywhere. And so much of analysis, counter analysis goes on, and that people start identifying themselves with the person who committed suicide, and it can sometimes lead to copycat suicides. So you have to be careful. Don't give so much media coverage about suicides. There are barriers to seeking help, stigma, embarrassment. You don't want to see the doctor, or you want to see the psychiatrist. What if somebody sees me going to see the psychiatrist? If somebody's got, let's say, a chest pain, signs of heart attack, you will never go and see an eye specialist for your chest pain. Same way, if someone is a pregnant lady going to hospital for delivery, she will not go to a ENT chap or ENT doctor for delivery. So same way, if you have a mental illness, you need to see a psychiatrist, because not unlike other illnesses, there is no blood test or no other physical test you can do to diagnose or monitor your mental state. It has to be done by somebody who's trained in understanding these symptoms and signs. And psychiatrists are highly trained professionals to understand this and help you with that. So please see a psychiatrist. Problems recognizing the symptoms, and people don't really recognize they come with the backache, headache. They themselves don't know they're suffering from depression, or others don't pick it up. Or sometimes they are in denial. Oh, I will never be depressed. It's a sign of weakness. I can't be weak. They would rather say, I will get over it. They want to rely on themselves. They don't want to ask for help, especially men. They are the last usually to ask for help, unfortunately. Access is another problem. You don't get psychiatrists everywhere. Um, People in remote areas, they find it very difficult, even if they want to see a psychiatrist. So that is another drawback. So they end up seeing somebody who's, let's say, is not very proficient in assessing mental health cases, and you're given an inaccurate assessment. You're given some painkillers and an injection and sent back home for depression. So it happens. So look at the reality. It's very common mental illness, 1 in 4. And almost everybody is going to experience it in some form or the other in your lifetime. It could be you or it could be a loved one. So we have to bear that in mind. So, sorry, going back about stigma. There was a talk yesterday about stigma, so I'm not going too much into the detail of stigma. So in children, what is a warning sign for suicide? If they are experiencing bullying, it can be in school, online bullying, um, peer pressure, losing someone close to them, physical abuse, getting hit at school or at home, emotional abuse, sexual abuse, abuse of alcohol and drugs. If they have a history of mental illness, they're not certain about their sexual orientation. That's coming up as a problem, as a major issue. Verbal markers of what people, not always, usually tend to say. Sometimes they drop hints about, oh, I wonder what is the best way to commit suicide, or I wonder what would happen if I'm not here. How will other people cope? They say the life's got no purpose. I'm a burden. I'm stuck. I don't want to be here anymore. Behavior markers, isolating from others, basically not really with communicating with your friends or family. You clam up. You're withdrawing to yourself. You spend more time in your bedroom. Doesn't don't want to come out and mix with other people. Some people give away the possessions. They say, okay, you can have my stamp album, or you can take my um, music collection, or writing a will. Writing a will is not actually a bad thing. It's a good thing. But when somebody is depressed, they do this out of the blue. You have to be a bit concerned about that. Driving recklessly or becoming more aggressive, increasing intake of alcohol or drugs, searching about suicide on the internet. Preventable, like I said, is mostly preventable if the person gets help on time. So if somebody tells you, "Oh, I'm feeling suicidal," you think about it for 2 weeks or 3 weeks, and then you say, "Okay, I'll take you to the psychiatrist." That's not. It doesn't. It's not helpful. It has to be timely. It has to be immediate, and the appropriate person need to be found to help this person, this victim, not victim, this patient. You treat the cause. It is, if it's a depression, you look at the triggers, what is causing, you address the cause. Not always you can address the cause, but you can help them cope with. If it's a bereavement, somebody died, you can help them cope with the loss better. There are ways of doing it. Restricting access to, like farmers case, restricting access to pesticides, like in Cuddalore in Tamil Nadu, they have I think they implemented a system where they medicate the pesticides are locked up in a central facility, so they don't have immediate access to pesticides. This has cut down the number of suicides. In UK, they cut down the number of paracetamol tablets you can buy at one go. So you can get only two small boxes. I think it's about 16 tablets each box. So people who really want to kill themselves, they can go to different shops and buy, yes. But just by doing that, it has reduced drastically the number of paracetamol overdoses. Because most of the suicides are impulsive or something gone wrong. They wanted to try and it's going wrong. It may be a cry for help as well. So increasing awareness about mental health issues among paramedics, teachers, nurses, awareness in schools, colleges, universities. Schools can invite mental health professionals to come and give talks maybe once a year or twice a year. And exams results, when they come out, you can read newspapers, there have been increasing number of suicides. So supporting students who are not really happy with their results, who are very upset, supporting them, um, it's crucial, it's important. As an institution, what you can do, if somebody is not feeling very well, low in mood, try to speak to them, take them away to a private space, talk to them openly, see whether they confide in you. Don't talk to them in front of 10 other people. Be a good listener, be non-judgmental. Don't say things like, "Yeah, I knew you were bunking classes. This is why this happened." Or, "I saw you were going around with that boy. That's why all this happened. You should not have done that." So be non judgmental. Don't say things like that. Don't be critical of that person because they will never come to you. Encourage them to speak to somebody they trust. It may not be you. So you can talk to them, but you can ask them, who do you trust? Who do you want to speak to? It may be a friend, it may be the parent, it may be anybody else, spouse. So if they say something to the tune of, "I want to end my life, I want to harm myself," or something like that, seek help immediately. Don't leave them alone. Hand them over to somebody who can look after the person, or if you think something is going to be something is going to be imminent, then the patient may need to see a psychiatrist immediately or get admitted in the hospital. As an institution, you can organize sessions to increase the awareness. You can train the staff in recognizing mental distress, and if there is a suicide or attempted suicide, in your college or university, student or staff member, how to break that bad news sensitively to the other people. Don't glamorize the suicide. Don't share the details about the method, how they died. What you should do, listen to them. Let them know that you notice a change in behavior. You can say, "Oh, I'm afraid I noticed you're not feeling or looking all right. You're withdrawing. Is there any way I can help you?" Encourage them to talk about their feelings. Again, non-judgmental, just being there for them. That helps. Getting off their chest, talking to somebody, it really helps. You can reassure them, saying things can get better, give them some hope. Avoid using cliches like time is a healer. That's not really going to help. And you can suggest somebody, a professional psychiatrist or psychologist, and you can even offer to go with them. Don't ever tell them things like, "Oh, get your act together, snap out of it, pull up your socks and carry on," things like that. You will be fine. Are you planning to do something silly or stupid? So if the person wants or thinking about suicide, and if you say that, they will think, "Oh, it's a silly thing, so I will not tell anybody." He'll be still considering it, so they will not open up to you. Most of the people who have suicidal thoughts do talk about it. If you ask about it, they will say, "Yes, I have these thoughts." Okay, it's how you ask. So there's a misconception. So people who are suicidal will never say that they're suicidal. Most of them do say. Don't ignore them or stay away from them. Don't tell them that they just need to get busy and keep your mind occupied. Friends, colleagues, please don't tell them to go out and party more to wipe off their feeling, or have a drink or take these drugs, you'll feel happy. Because alcohol and drugs are depressants and they're dangerous. Treatment, there's various treatments for depression. If you go to the psychiatrist, and he or she is the ideal person to determine what is the treatment for your conditions. So psychological treatments, there are various types of psychological treatments. I won't go into the depths. There's mindfulness, cognitive behavior therapies, there's psychodynamic psychotherapy, got family therapy, counseling, etc. Pharmacological interventions, which is medications. So you can give medications on their own or in combination with psychological therapy. Okay. People sometimes are reluctant to take psychiatric medications thinking that they're addictive or they have to take it lifelong. That's not the case. So you don't have to take it, like very, very, very rarely you have to take it for a long duration. So usually it is like 6 months to a year maximum, and it has to be stopped or weaned off gradually by the doctor, not by yourself. Because it's like if you take a medication for blood pressure, and if blood pressure comes to normal, you don't stop the medication straight away. So you need that medication in place to keep you well, sometimes longer. And it's not an addictive medication. You may get withdrawal if you stop suddenly. So it has to be done by a psychiatrist if they advise stopping the medication. Social interventions, and again, we can talk about that later. And lastly, ECT, that is mainly for severe depression, life-threatening situation, severe mania, catatonia. Catatonia is when people assume postures, can be an agitated catatonia, or it can be like they just get stuck in a posture, not eating and drinking. And catatonia can be helped with ECT. Severe depression, not eating and drinking. If you don't treat them with ECT, ECT is basically electroconvulsive therapy, shock treatment, otherwise known as. Some people are shocked by hearing that, but it is a well-recognized treatment and is very effective in most of the cases. Social interventions, I just mentioned, so schools, collaborative working, you can devise some anti-bullying strategies if bullying is an issue in your school. attention. So sometimes the parents may play a part in the child or the teenager's mental illness because they have their own mental health issues. Sleep hygiene is something you can talk about. Going to bed early, no internet, no movies. Excuse me. An hour before you go to bed, have a warm shower, have a glass of warm milk, wind down basically, read a book or something. Restricting social media on to restrict online bullying. Mute people who are rude to you or unfriend them. Peer pressure. Excuse me. Exercise, yoga, meditation, all this can help. ECT, just a quick word about ECT. This is the machine we use here in our trust. This is called, it's a model by Thymatron. This is what we use. A patient is anesthetized, given a muscle relaxant. You connect these EEG leads. EEG is electroencephalogram. It's like ECG for the heart. You're looking at the tracings of the brain. You have placed these electrodes, you give a monitored, very ultra brief shock. It's all controlled by the machine. You can set the strength of the current, the duration, etc. The machine determines the duration, etc. It's a very safe way of treating. It's safer than sometimes it's even the side effects are very low. It's more effective, and it can't. In some cases, it cannot keep you well for long. So obviously, after you finish the course of ECT, you need to continue taking your tablets, medications. This is something I am interested in. It's repetitive transcranial magnetic stimulation. We are doing some research on different types of transcranial magnetic stimulation. I won't go too much into it. I'm aware it is available in India as well. It is. There's no direct contact. You don't need even direct contact with it. There's a magnetic coil here on the top. You can see there's a magnetic coil. It doesn't touch your head. You can sit here, read a book or whatever. No anesthesia, nothing, and you have regular sessions daily for a few weeks. There is some evidence for that. Prognosis of depression, what happens? Yeah, almost 60%, 58% completely recover. 24% have partial recovery, so they may have periods when they have remission. Remission is when they are well, and they may have a relapse depending on a trigger. Sometimes the trigger you can identify, sometimes you cannot identify the trigger which causes depression. Some of them, 18% register relapses. So coming back to COVID, which is a lot of interest now, I have experience of looking after patients with COVID, mental health patients who are COVID positive. So we had about 20, 25 patients who were COVID positive, who were mental health patients. By the way, they were diagnosed with COVID. They had symptoms of COVID. So yeah, main thing is isolation. You don't have that peer support. You're not going to work. You're stuck at home. You may lose your job, financial pressure, or people are taking a pay cut. And loss of role. You're not the breadwinner anymore. Maybe your spouse is looking after the sudden change in the situation. It is a pressure cooker situation because everybody is at home all the time, so their tempers, um, outbursts, all that happen in the house is like a pressure cooker waiting to explode. Domestic violence, everything increases. There is obviously a fear of illness, fear of catching the virus. What could happen to me if I get the virus? There's a stress and anxiety and can lead to depression. So how do you cope with lockdown? So you have to be kind to yourself, prioritize yourself, learn new skills, exercise, relaxation, reading, take up a new hobby, learn a new language. Some people are learning French, Spanish, Chinese even, or learn a new skill. There's so many things happening online. People are taking up to baking, cooking. You can see so many pictures on social media about cooking and things like that. Keep in touch. There are so many other ways of keeping in touch in this current age of internet, so you don't have to physically see the person. Avoid rumors. If you read all the news on WhatsApp and Facebook, etc., most of the news are fake and false. Look for quality information. Look for sites, websites who give you real, true information. If it's bothering you, don't watch the news. I have a few patients who are obsessed with watching every time news about coronavirus. Yeah, be your best friend. Be supportive and kind to yourself. Your diet is very important. People tend to lose weight, mostly gain weight during lockdown period. Yeah, I myself have gained some weight. At home, be available to your family, be available to your children. Have a schedule in your family. You say, okay, morning, this is what we are going to do. Afternoons is what we're going to do. How we spend time. Be sensitive, be alert to the emotions of your children or teenagers. They may have worries. They may have read something on WhatsApp, something about maybe people, so many people dying and the mortuaries filling up, all that kind of things they read. They're worried. So be alert to it. Talk to them. Limit news coverage. So watch something else. Watch a movie, something happy, family movie, or have a sit down and have a game with the children. Have a schedule for the children. Spend more time for family together. Take home message. Mental illness is very common. It is an illness like high blood pressure, diabetes, or heart disease or something. You can't just shrug it off and get on with it. You need help, and you need the right help at the right time. And you have to be kind and supportive to those who suffer with mental illness. It could be you or your loved one tomorrow. It's completely treatable in most cases if it's managed well by seeking appropriate help, which is a psychiatrist, and it has to be timely at the same time. This is a link to support groups and things if anybody is upset or affected by the talk today or brings back memories. If you're upset, there's help available. So if you click on this live laugh live love laugh foundation, I believe it was set up by one of the Hollywood Bollywood actresses, Deepika Padukone, and they got a lot of sites or they signpost you for appropriate help. Just to feel good quotes, I'll give you a couple of seconds to read through it. And finally, my contact details. And if you have any queries, you can always contact me. I may not be able to get back to you straight away, but I will go through them at least on a weekly basis. So don't expect me to get back to you straight away. I'm sorry about that. And thank you. It's Q&A time, question time.
Thank you, sir. Many participants have wanted to clarify their doubts. Shall I read out the questions, sir?
Yep, I'll try my best to answer the questions.
Yes, sir. So playing PUBG affects children. How to prevent addiction among school children?
So we did speak about addiction. Is it addiction to? I assume it's addiction to internet games. Games. PUBG is a game, isn't it? So basically, you need to be careful how much time they spend on it. Like I said, you need to know what the game is about. Watch how they are playing. Sometimes children get frustrated with the game, and sometimes you can see them throwing up their arms and they make noise, and tell them, okay, take a break, leave it, and don't move around because you're sitting down, you become like a couch potato sitting basically. So move around, come out of it, see what really happens there. So, like I mentioned earlier, the other people are playing, maybe using bad language, and or maybe making remarks, sexist remarks, or racist remarks, etc. So you have to be careful. And addiction, again, you got to restrict. You're as a parent, you have to make sure there's a limit how many hours they can play during the day, and it should not interfere with your daily routine, like your studying or sports and games. It should not take place in the place of other normal activities.
Okay, sir. So how can we help a child if he is disconnected from the outer world, feeling discomfort while talking to outsiders, and having parental disharmony at home? The reason for this behavior can be related to his failure of not coping in studies.
Question.
How can we help him?
So if somebody withdrawing, it could be many reasons. So you did mention one reason, that is parental disharmony at home. How that parental disharmony is affecting this child. Is he witnessing things happening at home? Is he being a part of the disharmony? Because parents usually dispute. You are the one who's spoiling the child, and so the child sometimes plays a role of a pawn in the fight or the disharmony. So that's not going to really help the child. And if he is struggling and if he doesn't want to talk about, I mean, obviously people are reluctant to talk about their issues they face at home to strangers, teachers, or anybody. So they don't have anybody to really confide in. So that they tend to bottle it up themselves. So it can affect them. It can lead to depression, low mood, and they could resort to drugs, alcohol, unhealthy coping mechanisms they can resort to.
So he or she can be taken to some other person to
Of
be
course,
open.
yeah. So they need help, basically. That's what I was trying to tell. So you need to speak to this person and seek appropriate help, which is again, you nip it in the bud. You can help the person very well. So psychiatrist again. So you have to knock at the door of the psychiatrist.
Uh, Sir, how do you differentiate normal mood off and depression? Is it possible to be mood off for more than a day or two?
So that's a very good question. So mood changes can happen to anybody. All of us have mood changes. So uh, there are days when you feel top of the world. There are days when you feel rubbish. There are days when you don't feel too good. Like if say you lose a pet, or something bad happened to you. You were coming back from college or something, somebody snatched your bag, lost the money, credit card things, you're going to be upset. You're going to be unhappy. It may last for a day, sometimes a couple of days. You lose a pet, it may last for 2 3 days, maybe a week. So if it is prolonged and then it starts affecting your life, you start thinking too much about it, it's affecting your day-to-day functioning. If it you start getting thoughts like, oh, I wish I wasn't here, that kind of morbid thoughts start coming in, that is a sign of depression. So it's pervasive. It lasts almost whole day, every day. So even if you're so if it's a normal mood variations, that most of the time you're happy, but sometimes you feel a bit down. But in depression, it lasts almost whole day for every day.
Okay, sir. Okay, sir. So I understand that if it is persistent and if it affects our daily life, we need to seek the help.
You need to seek help at least 2 weeks, according to the ICD-10 classification of mental disorder. Yeah.
Yes, sir. Thank you, sir. So, what is the legal implication that teachers should be aware of in relation to suicide?
Legal implications, I'm not entirely sure about what do they mean by legal implications. So, as far as I'm aware, suicide was considered as a criminal act in India before. I'm not sure whether it is still the same. I have a feeling it is not anymore. I'm not entirely sure about that. But legal implications, if somebody is abetting or aiding suicide, that is a criminal act. Even in UK, if somebody wants to die, like euthanasia, it's not permitted here. In UK, people sometimes they go to places like Switzerland for euthanasia. Euthanasia is basically you want to end your life because you have a chronic illness, not because you're depressed. You have a chronic illness which there is no quality of life, and you have to satisfy various criteria. But it's not legal here in most of the European countries, and I'm sure it's not legal in India as well.
Yes, sir. Do introvert children suffer more from depression than the extrovert children?
Well, it's introvert. I mean, personalities do influence your mental state, of course. So introvert, in the sense, you tend to keep everything to yourself. You don't want to open up. So that person, if he's going through a stressful situation and if he's not opening up, that that can make him more prone for depression and low mood and depression. Extrovert, on the other hand, sometimes even people who are depressed can be trying to cover up their depression by being more, appearing more happy or being more extrovert, taking up dangerous hobbies, skydiving or things like that. They want that stimulation. They want that adrenaline rush to keep going because it's like a drug to them. They need that. And if they don't have that rush, so you can see people standing on top of skyscrapers without anything to hold them and all that. That kind of rush, they need that. It's like a drug for them. And so they need that to keep their mind stable. If they don't have that, they become depressed. So it can equally affect both.
Yes, sir. Sir, ADD in children, a mood disorder. Should a male teacher who is approached by a female student refer her to a lady teacher?
I'm sorry, can you repeat that question again, please?
So,
ADD children?
uh, is ADD, like attention deficit disorder in
Yeah,
children, is it a
yeah,
mood disorder?
yeah.
And second question they have asked, should a male teacher who is approached by a female student refer her to a lady teacher?
Okay, so attention deficit hyperactivity disorder, or if they're not hyperactive, it is just an attention deficit disorder. It's not uncommon in children. So some people may not know what it means. So I'll just briefly say what it is. Basically, it's diagnosed quite early, usually in life. People they lack, basically, as the name says, they can't pay attention for too long. They can't sustain attention while teaching. They are restless. They're moving around. That is ADHD, hyperactive disorder. They can't wait for the turn. So if the teacher is asking a question, so everybody puts up the hand, and before you given a chance, you blurt out the answer because you want to say it. You just want, you don't have the patience to wait for things. So and they jump from one task to another task. It's okay. So they are more prone for depression. ADD, it's one of the comorbidities of depression in children. So you get ADD children with depression. Also, illnesses like conduct disorder is another comorbidity in children with depression. When I say conduct disorder, it basically means children who can be, some children who can be very cruel to animals, uh, pathological lying, stealing, and slightly more grown up adolescents, they become attacking opposite sex. That kind of people can lead, when they grow up, can become like an antisocial personality disorder. So depression is quite common in them.
Should we approach a
What
female?
was the second question? Sorry, the second part of the question was about the male teacher, isn't it? So I forgot about that. So yeah, I mean, there are, if it's a female student want to open up to a male staff member or vice versa, you have to be careful in the sense it has to be somewhere not in a even though I spoke about private area, not in a closed, enclosed area, it if it's ideal to have somebody with you for your protection, your safety as a teacher, because you don't want to be accused of something which did not happen, any allegations made against you. So if it's a female coming to a male, I would rather have somebody female with me who the person can trust. It may be this person's friend or someone, but from the opposite sex, it to be, and also make that person feel more reassured because you're talking to somebody from the opposite sex. You feel reassured there's somebody else there. Like it's like going to a clinic, hospital, and you see a male doctor. And if you're a female and you see a male doctor, and if you feel more at ease when you see a female nurse standing there rather than only the male doctor. So it works that way.
Okay, sir. So students' mental health issues are not given importance in India. Do you think that appointing social workers in schools or colleges and educational institutions should be made as mandatory in India? The foreign countries make it mandatory, sir.
Absolutely. I mean, I don't know about making it mandatory, but it is essential. So we have to look at a lot of other issues, like in an ideal world, yes, every school should have social workers, every school should have a counselor, every school should have a nurse and a doctor attached to it in an ideal world, but it doesn't always happen because of so many issues, resource issues. You cannot afford to keep an extra staff member. Um, I mean, most of the time that person is not going to be doing anything. They will be waiting for something to happen or somebody to be referred to them. So you have to pay that person. So resource issues, finding an adequate number of social workers, even if you have the resource. There are other issues. So yeah, but in European countries, especially in the UK, yes, you have people attached to the schools because they are more well resourced here. So, but things are changing in India, and I'm very optimistic about India, and it will get better. It is already getting better. That's why we're having this conference, isn't it? It's a awareness conference. Yeah, exactly.
So family disputes lead to students' mental unwellness, which is common in educational institutions. So they wanted to know whether the counseling need to take place to the family also. The teacher wanted to know whether family counseling need to be given through colleges, in colleges.
Well, so counseling, I mean, counseling is you have various types of counseling. So the counseling basically it is a type of a psychotherapy, it's a talking therapy. So counseling can be for a specific purpose. It can be for like if somebody's going through a divorce, you got divorce counselors. If you want a genetic test, you got genetic counseling. Same way, depression, mental health, they all have counseling, different ways, different types of counseling. There's one-to-one counseling available. So where the counselor sits down with the person, and sometimes they find that there are more issues in the family, the underlying issues in the family. So they invite family over and have a discussion and look at unhelpful behaviors within the family dynamics. So a counselor ideally is helping you find what is happening in your life, what are the triggers, and they don't usually tell you to do things. They will make you realize these are the things important. They can even help you with making sure that you're compliant with your medications, you take your tablets regularly, seeing your doctor, follow up, etc. So it can help. So did that answer the question?
Ah, yes, sir. Yes, sir.
Okay.
So some people are able to remember formula and methods, but they are not able to remember other activities. What is the medical reason behind this?
Well, able to, I can remember still some formulas from my school days. So I don't know whether it's a medical illness, but I have found Asians, especially Indians, Chinese, We are we are quite good in mathematics and things which you need working mentally, you need working, so that kind of it's almost like a computer memory. So a lot of people do have that. So I don't think there's anything wrong with that. And if you look at in rare cases like autistic spectrum disorders, some children um, have extra ability to focus on one particular thing, and they can remember um, dates, or they can remember the if you ask them 12th of August 1950 what day it was, they can tell you. I mean, it doesn't have to be autistic, but sometimes they have this ability to calculate. But it's not abnormal. What I'm saying is people do remember formulas. Some people are more mathematically minded. I don't think it's any abnormality. Don't worry too much about it.
Okay, sir. Sir, why is that women are more prone to suicide?
Well, one reason is more chances of depression, and depression is the single highest risk factor for suicide. So the question now comes, why are women more prone for depression? So women, on the other hand, the hormonal changes which can affect your mental state, uh, changes associated with puberty, and then there's a lot of stigma attached to menstruation, menstrual cycle. You go through pregnancy, there are issues with pregnancy, psychological issues, like you can feel like people are not supporting you well. There may be real issues, you feel unsupported. You're taking a maternity leave, you're sitting at home, you don't have the support of the peer group with you. At the same time, you are playing the role of looking after your husband, coming back from work, looking after your husband, cooking. So your work never ends. My wife always says that my work never ends. So they take on so many roles, and so being a woman, and also women, if they try to live on their own like a single parent, sometimes they are financially they're not that viable. So there are more difficulties they face as a society. As a single mother faces more difficulties in all spheres of life. So this can affect your mental state.
Yes, sir. What are the risk factors, triggers for depression in teenage group?
Depression in teenage, I did mention about that. So there are so many factors, like biological factors, social factors, psychological factors. So it could be female sex is one of the predisposing factor. There's stress, bullying. Now you have this online bullying, trying to fit with the society, trying to look good, appearing good, so feeling good. All that it affects your mental state. And there's so much pressure on teens, isn't there? Sometimes they are pressurized by families to take up um, professional courses or whatever. They're not very keen on. They're not keen to do it, and they just do it just for their parents' sake. Parents do it because they want to keep up with the other people. So it puts a lot of pressure on teens, and then you got the peer pressure. You are undergoing a lot of change yourself as a teenager. Puberty changes, hormonal changes, so all that predispose you for mental illness.
Sir, how to help a single child who is not in touch with his peers and there is no outings? He's always on the laptop. How can we help the child
Okay, you help a child as a parent or as a teacher.
as a parent? Because single child they have mentioned, sir, maybe in the
Okay.
home. Yeah.
Yeah. So, yeah, single child, again, that means that he doesn't have a sibling or anybody to talk to. But there are so many things the parents can do. I mean, they can restrict the time. They can restrict the time this child spends on the is it computer online games, whatever. So they can restrict the time, limit the time. They can find other ways, spend more family time together, sit and play games with them, engage them in other things. Um, uh, uh, Make the child join some group or clubs or something. They have clubs, classes for other things. So just try to get them out of the rut, basically.
Okay, sir. Okay, so this is with regard to epilepsy, seizures. Sir, can you please tell me how can epilepsy be treated, or is it last for the whole life? Is it a psychological? Is there any psychological treatment, or this has any medication in life? For
Okay, epilepsy. I'm not an epilepsy specialist, but it's more neurology. But we do get patients with epilepsy, and it's one of the causes of low mood. And sometimes people are called epileptic personality because they may have short temper, they have mood fluctuations, so their mood can change up and down easily. And epilepsy itself is upsetting for the person, isn't it? I mean, you never know when you're going to get the next fit. You could be driving, so they are restricted from driving. So there are in UK there are so many regulations about epileptic people driving. Anything can bring it on. Flashing lights when you're watching television can bring it on. So if you're a lady, the last thing you want is, or a gentleman, eh, waiting for a bus or something in a crowded bus stand and you have a fit lying on the floor. It's not a nice thing. So all this can upset them. About medications, anti-epileptic medications are usually lifelong. As far as I know, are usually lifelong. And never ever stop medication on your own without consulting your neurologist. Yes, these medications mostly work both ways. Most of the anti-epileptic medications are also mood stabilizers. So it stabilizes your mood. So it can help both ways. It can help with your mood as well. So any medication for that matter, psychiatric medications, epileptic medication, never stop on your own. Always discuss with the doctor before you do it.
yes, sir. So, how do school counselors or teachers uh, know when to refer a student to a psychiatrist?
Okay, so for example, a child comes to you, talks to you, opens up to you, saying, "I'm having issues. So and so is behaving abnormally to me. Um, he or she is bullying me, or I'm having issues at home, um, and maybe genuine issues like financial issues at home, and the parents are struggling and they're not able to provide and cater to the child's wishes. And sometimes children are understanding, sometimes they're not. So if they open up things, I mean, if you think, yeah, this is something you can help the child with, talk over with the child. So anybody can be a counselor to some extent. So whatever the psychotherapy is basically talking therapy, so it can be done by anybody. So you can, if you think you can confidently handle the situation, and if it's not anything serious, like the child is starting neglecting studies or things like that, or suicidal thoughts, then if you're confident enough, or if you think I'm not able to listen to the child because I have similar issues of my own, I'll refer him to my colleague. And if you think this is beyond I'm out of depth here, he or she needs professional help, please request professional help straight away. Don't wait.
Okay, sir.
If you don't feel confident, don't do it.
Okay. Sir, failures among uh, the current generation of youth takes them to adverse decision making. So, what could be the best coping strategies that can be given to the youth? One question, sir. Second question, same a faculty has asked. Among young girls, unsuccessful teen marriages also changes their life. What's your best advice you can give it for them?
So let me deal with the first question. So first question is,
Yes, sir. Uh, generally current youth are not able to cope up with the failures. So how can we help them to cope with the failures?
Okay. So I don't think it's just the current youth. I mean, always people took failures in different ways. It's how you cope with the failure. I mean, failure can be anything. Failure can be in your relationship with a loved one. Failure can be a love failure, or it can be academic failure, or failure to live up to expectations of your parents, of your peers. So different kinds of failures. So I think it's always been there. So nowadays people have more avenues to talk about it, and they can open up. There are online forums to discuss about it. Most of them are helpful, some of them are unhelpful. So if you are a failing child, I can't call that failing child. If you think, if you believe you're a failure, go to a site, and then you find some people are mocking you, making fun of you. That's going to be making the situation worse, isn't it? So, but I think the current youth have got more support, more awareness is there among the public, more resources are there, more doctors, more psychiatrists, more counselors, therapists, all available than 20 years ago. So I think the current teens should be able to cope with if they receive the appropriate help at the right time. And what was the second question?
Unsuccessful teenage marriages.
Mhm.
So what's the best advice we can give for them, sir?
So when we're talking about unsuccessful teenage, I'm guessing it's like 19, 18 and 19, isn't it? Legal marriage age. So, um, yeah, I mean, again, there may be reasons. It's not always the marriage itself. Is the person ready for marriage? Does the person want marriage now? It may be somebody, it may be a lady who wants to pursue her studies. She wants to uh, complete her course or whatever, but the parents are pressurizing her. We won't get such an alliance in the future. This is the best boy we found, or the best girl we found. There may be a lot of pressure, putting pressure on this person. And most marriages, the couples, they don't know, they may not have met each other before. And I think 18 and 19 is a bit too young for them to get married. So that it brings along a lot of other issues. Okay. And intimacy is another thing which can cause problems because of less awareness and less education about sexual education, etc. So it can cause problems.
Okay. So how to handle psychosomatic disorders in college students? For example, student may show breathlessness because of psychological problems they may have. So at that time of situation, how a teacher has to approach.
Okay, it's not uncommon students displaying somatic symptoms like dizziness or hyperventilation, that is excess breathing or feeling breathless. Uh, so it can be a side effect. It's called not side effect. It can be a symptom of anxiety. So the anxiety can lead into what we call as a panic attack. So in panic attack, they just feel that they're going to lose control, they're going to collapse, so they're going to die, and they start hyperventilating, which means basically they start breathing excessively. And when you breathe excessively, you have very less carbon dioxide and excess oxygen in your system, make you feel more dizzy. You can get cramps in your fingers. You can collapse. So in your mind, you have these thoughts that you're going to lose control, and you get the breathlessness, you get the palpitation in your chest, you get butterflies in your stomach. So how do you cope with the situations? Sit with the person, try to calm down, talk to them, try talking to them, hold their hands, speaking to them, tell them to take the breaths slowly, deep breaths, tell them to breathe. So relaxation techniques, breathing exercise, we call it. So tell them to take a deep breath, keep it and leave it out slowly, and then take another deep breath, keep it for some time and leave it out slowly. So deep breathing exercise can relax the situation. It's not always medication. You don't straight away give medications like diazepam or something like that to calm the person down. If it is unmanageable in the college situation, obviously you need to request help. Usually these techniques work. Some people breathe into paper bags and things to calm themselves down. It's not advisable. It's like sticking a plaster. It is not a real solution to the problem. Obviously, they need further help. So you can't just tackle the breathlessness then and there and leave it and forget about it. So you got to take it, carry it forward, speak to the parents, inform them this is an issue here. She may need help. She may need to see a psychologist or a psychiatrist. She or he.
Okay, sir. Sir, one final question. With regard to depression, is there any treatment modalities other than psychiatric treatment without medication? Self uh, therapy kind of thing. Which would
Well,
be-
yeah. Early depression, we advise there are so many self-help books they're available. There are online cognitive behavior therapy things which you can do yourself. So there's also something called guided help, where a person will take you through the online CBT and self-help groups are there. There are some groups which you can talk to. There are people with mild depression. So it works for mild depression. When the depression starts affecting your functioning, day-to-day living, etc., then you need to seek help. But then exercise is very helpful. So exercise daily, at least 5 days a week, that can increase the amount of endorphins in your brain, which is like a happy neurotransmitter in your brain, happy chemical. Exercise again, it helps your muscle strength. You feel more confident. Start liking yourself. Look at yourself, you're looking better. That can improve your self-esteem, your confidence. So exercise, yoga, meditation, all this can help. So you don't have to always take medication straight away unless the illness becomes more serious.
Just say this is the final. Okay, sir. So on more final question. This is the final question, sir. What
Yeah.
should be done if someone is posting suicidal messages or something disturbing on social media?
Sorry, I missed the first part. I missed it. The voice was cracking.
If someone is posting suicidal messages or something disturbing on social media,
What is to be done?
what the individual is receiving the message, what has to do that?
Okay, so it depends again. Do you know the person? Do you if somebody known, of course you can speak to them on the phone. Don't discuss things online. Speak to them straight away. Don't wait for next week or next month. Speak to them straight away. Ask them to seek help. If you want to go meet with them face to face, talk to them, asking about seeking help. Ask them whether can I talk to your parents? Can I disclose this to your parents or not? So you have to take the permission, and confidentiality is important. But if you think confidentiality can be broken, if you think that there is a risk person to himself or others, then confidentiality can be broken in those cases. And if it's somebody unknown, you just met them on the internet and they're posting suicidal messages, obviously it's distressing for the person who reads it as well. So maybe that person need like if it's a teenager, he need to speak to his parents saying, "Oh, my friend or somebody I met online is doing this. What do I do?" And the parent and the boy or girl can try and talk to this person. Say, speak to your parents, speak to your friends, approach, request help. There are websites, like I just mentioned, Live Love Foundation, Live Love Love Foundation. There are websites, and there is help available, and they don't need to take this desperate action. There are ways to help.
Thank you, sir. Thank you, sir, for sharing your expertise in the field. Your presentation has given us an understanding of the mood disorders and the easy way to identify the symptoms, recognizing it, and the way forward in seeking support for early intervention. Sir, we were also able to understand the verbal markers of suicide, particularly among youth. It was a very useful information, sir. And the session was so interactive. Participants have given a very positive feedback about the session. Thank you, sir, for spending your time with us. And thank you so much, sir.
I want to thank you as well. Thank you, Dr. Sharla and Shivan, for organizing this event, giving me an opportunity to talk to you all.
Thank you, sir.
And I hope the session has been helpful.
Sure, sir. Sure. Definitely, it was a useful information session, sir. Thank you, sir. Thank you for
Okay, thank you.
no, okay. Dear delegates, we will meet you again in the afternoon, which is the last session of this international webinar. Thanks for joining us for this third session. We will meet you soon in the evening. Thank you.